The key messages for the chapter on medicine that I've written, I think what I've tried to do is convey that prudent healthcare is already taking place. I've taken examples throughout medicine, which is a vast topic to start to actually explain, and say that in a large number of the areas that I talk about, we're already doing it, and that we need to actually learn what prudent healthcare is and take the principles of prudent healthcare and say, let's apply them to other areas where perhaps we're not using it so much as we are already. Key for me is reducing waste. I think as a physician, key to me is using evidence to inform our practice, so that we know that what we are doing is evidence-based and is good for our patients. And I think also that we need better engagement with our public. We need to be telling our public that we're doing this because we're using evidence, we're doing this because we want to reduce waste in the system, and we need that better engagement and that honesty with our public, with our patients, with our citizens. We can actually make substantial differences. The size of the differences that we make are there to be taken, are there to be used as we take forward the prudent healthcare agenda. Certainly, I think also the fact that ideas can be taken across primary care, secondary care, the tertiary care sectors, and that we can use those ideas to build across all of the components of our health service, and that can actually be achieved in significant amounts. It's not easy, it's hard work, but you can do that. You can get big changes in reasonably short periods of time. Rather like 1,000 Lives, where we've embedded improvement methods in a large number of our staff to learn how to improve the way they work, if we can see people thinking about waste, thinking about using evidence, and thinking about engaging our public, then I think that's what success is. I think it has a far greater potential and dimension than perhaps even just the improvement work, which is absolutely key to taking the health service forward and is embedded in prudent healthcare. And that's the sort of social contract that prudent healthcare brings in terms of working with our patients, working with citizens to actually bring these principles alive. So when someone takes this as a matter of course of their day-to-day job and actually uses that and it's embedded in that way, that for me is real success.